Hey there, welcome to the Neurotrition Podcast. I'm your host, Dr. Z, your holistic dad doctor, bringing you the ultimate mind and body approach. Today, we've got Sharik Peck, the founder and inventor of RezziMax, and we're going to talk about how we can use something like that to calm your nervous system and get rid of pain. Sharik, thanks for joining me. Thanks for tuning in, everybody. Sharik, nice to have you.
It's an honor to be here with you, Dr. Zademan. Thank you.
Hey, no problem. So, I know you have got a really cool. You've told it to me several times, but I really love the story kind of behind your background, how you kind of got to this point of saying, "Hey, I need to make a device." So go ahead, and I really am curious to hear that story.
Well, I'm happy to share it. Oh, it starts really early in my life. At about age 2.5 or so, I was dumped on my head. Some neighborhood kids spinning me around, dumped me on my head, and it broke my neck. And we didn't realize it. For years, I walked around with my head kinked off to the side, and we just didn't know what the deal was. But as I progressed further in life, I wrecked a three-wheeler one time and broke my back. And then just a couple years after that, I was wrestling, trying to do one of those things
Right.
to help a young man get strong. We didn't realize the problem created by the instability in my neck. And I got caught in a bad headlock. This was just after my junior year in high school. I got caught in a bad headlock and it ripped an artery. There's only four main arteries that go to your brain, and one of them ruptured, causing blood flow and blood clots into the right hemisphere of my brain. That started my real awakening and learning process, because I had to learn to walk again. I had to learn to talk and learn to function and learn to learn. And several years after that, as I finally got into college and tried to decide, okay, what do you want to do? I decided on physical therapy because that was something that had meant such a big, large amount to
Sure.
me after I'd had my stroke, helping me get back up on my feet, getting my balance back, getting to the point where I could drive again and function. Anyway, those were some of my early experiences that influenced my profession that I've now been in for over 32 years. But my wife, as we progressed along, I saw her getting severe instances of neck pain. And, it might have been that we had quite a few children. I've got 7 children. And there was a lot of stress on her shoulders from helping manage a practice, a
Right.
busy husband, children, and diapers, and all of the things that go along with that. Anyway, during one period of our time, for several years, she could hardly turn her neck. And it became very challenging to drive, to turn around, to look over your shoulder. But it was painful all the time. And I took her to all kinds of practitioners, from chiropractors to medical doctors to surgeons, and nobody could seem to help me figure it out. It was during those years that I started studying everything that I could to help me figure out how to help her and others like her in such
Right.
chronic pain. For me, pain had just been a part of my life. I've always had neck pain. I've always had jaw problems. But for her, I really wanted to fix that. So that was really the beginning of developing some of the thought processes that have helped us to help so many people throughout the world now.
And I'm curious too, because obviously, especially where you're at now, not what you would say a typical physical therapist would be doing, right? With some of these tools that you're using. I hope that is the standard as we go forward for sure. But was there a point where you were kind of, thinking you were going to be doing like very traditional physical therapy work? Was it really just going down this rabbit hole of, trying to help your wife? Which I have a similar story. I did the same thing, right? Different way of going to it, but same thing. When my son stopped talking, I needed to help him. I changed my whole direction and ended up changing my whole way I practiced. Were you already trying to trend that direction, you think? Or was it really, as you went doing trying to help your wife, is that really what catalyzed the change in how you even practice?
As I look back now, I can see all kinds of things that happened to get me
Sure.
pointed in the right direction. Like I spent probably 13 years of practice working in the pediatric arena and working with children, but I didn't realize some of the things that I know now. I wish that I could go back and help those families in a much better way than I had before. But there are so many things that it was like the perfect storm that created the momentum to help me develop the tools that we've developed.
That's really cool. That's really cool. So, what I it's such a unique device, and we'll talk about this. I don't think there's really there. I know there's nothing really out there like it is. What what there had to be something that triggered the eureka moment. I'm really curious to hear what that is.
So one of the most fascinating things was I talked to a therapist one time. He's a cousin, and we were at a family reunion. And I said, "Look, my wife is struggling so bad. What can we do to help her?" And he said, "I don't know if I can help, but I've been learning some things. If they do help, you should know fairly quickly." And he had her lay down on the grass and just started playing with some things around her head and face. And suddenly she could turn her neck and move it. And the aha light popped on for me and said, "Whoa, there's so much that you don't understand." And that was like this crucial moment that started me on this role. I went back to school. I got a master's degree in counseling because I wanted to understand the inner turmoil component of pain.
Sure.
and and I started studying everything I could about the nervous system and neurologic disorders and what's involved in fibromyalgia and chronic migraines and all these conditions that had been so hard to treat. I wanted to now understand them at a level where I could understand the mechanism and understand how to be able to help somebody in a much stronger way. Just as my wife had been helped in minutes to unlock her neck, I wanted to be able to do that for so many more.
Yeah, and so it's interesting you bring up trauma. I think that's highly underrated as far as the emotional aspect of not only pain but just health in general. I know how it went to the forefront with me is, I ended up seeing a lot of foster kids who had developmental delays, and it totally makes sense. I mean, there's adverse childhood events. We call them ACEs, right? They're everything from abandonment to having a caregiver that went to prison or abuse, and all those things. If you have a score of that, we know that the mortality rate, those individuals don't tend to live as long. They have more chronic health conditions. It's really, and it affects their neurodevelopment. We definitely know that now. It's a scientific fact. What I'm curious is that how did you know to even consider that? Because a lot of practitioners don't, and I think it's something that we all have to be looking at. I'm curious what made you think, hey, I got to make sure I'm considering this aspect of it.
Through my studies, I started to realize that there was a common denominator in just about every single condition, and that is the stress response. The stress response to early childhood events, or the stress response to everything happening today, or speeding through this world at 500 miles an hour. There's just so much stress and perceived stress on the nervous system. And in further study, I realized that there is one particular system in the nervous system, one particular system that is at such a disadvantage with the high degree of stress and trauma. And that's everything run by the vagus nerve. It's the autonomic nervous system. It's the things you don't think about that just happen in the background, but the spleen and the liver and all of these organs that have to work and function well for a person to be healthy and happy. Those those organs and those systems and that communication system with the brain is depressed for everybody that is going through a chronic stress or a very high anxiety experience. So that's where I focused.
Yeah, and I think it's also important to realize that even happens during pregnancy as well. Stress and trauma during pregnancy can actually be transmitted physiologically through the child neurologically. And we could probably do a whole episode on that alone about how all those mechanisms work. And it's really quite fascinating, but that's always something I'm going to ask right away is, not only was there any stress during early development, but what happened during pregnancy? Was it a stressful time for the mother then? Because that has such a huge impact. And you talk about the vagus nerve, and I think we both agree that's probably our favorite nerve in the body. That does a lot of things. When people talk about how the gut and the brain are connected, for instance, that's the vagus nerve. And there's also something called polyvagal theory, which is the development of that system. Right? There's pretty much two parts. And we're born with only half of it. And people don't realize that has to develop. And whether it's trauma induced or, environmental, can be a million reasons why that doesn't develop. But not only will that affect the emotionality of an individual, so their social engagement, for instance, that's the more developed part of the vagus nerve. But it also will impact the physiology, right? How your gut moves, how your immune system fires, all of these different factors that we sometimes think is a physical problem. It actually can be very much an emotional problem. And I know you've also done a lot of work. I know a lot of the protocols and things you use with your device is even meant for PTSD. So even with like PTSD individuals, you can even have that system operating pretty normally, have this emotional trauma, and essentially cause a decoupling of that system, I think is maybe the best way to say it. And you go more dominant on that more primitive part of your nervous system. And so I think it's really fascinating to think about that. Counseling, all these things are so important, but you're right. We have to be thinking about how the nervous system is impacting or not impacting our response to all those things.
Well, and if you take it a little step further, you can name any condition that we have in the body. You can name cancer, peripheral neuropathy, vision problems, heart problems. Every condition that you can find and almost every orthopedic injury that you can have can be affected by or influenced by the functioning of your vagus nerve. It is the controller of the anti-inflammatories for the body. So anybody with autoimmune disease, anybody with any kind of physiological pain condition is affected by limitations in the ability for that vagus nerve to function freely and help a person.
Right. And it's something that we talk about pretty much with every patient, whether it's a child who's on the spectrum or just an adult who has chronic pain or, like you said, autoimmune disease. That's always something we're going to be talking about. I tell parents this all the time. It's like, when your child gets nervous and doesn't want to go to school and they say they have a stomach ache, right? I get that the pain's probably real. It's just not. It is a neurological response. But that pain perception, that physical symptom, is a real thing. They're not most likely not making it up. It's just triggered from a different part of your body. So I think that's really fascinating. So talking about the science and the vagus nerve and kind of what we're targeting, what made you think? For those who don't know, this device is based off vibration. So what made you think that vibration was the key here?
One of the coolest things that I was just studying everything I could, and I realized that your vocal cords are a branch of the vagus nerve. So when a child does develop speech, that's engaging a part of the vagus nerve that is not very involved in just keeping you surviving. You might look at it as a branch of the vagus nerve that's involved in keeping you at a much higher level of function and connection in your community. But your vocal cords, the recurrent laryngeal branch of the vagus nerve, is responsible for vocalization. And doing further study, I realized that animals tune in to vocalization, and it's such an important part of hearing somebody and listening to their quality of their vocalization is a big part of how healthy they are. Um, in fact, one experience that I had this week that I would love to share is a young lady that came in. She had been in a solid headache for 6 years, just rarely ever had any moments of respite, and it was severe. And she came in, and her eyes, she couldn't hardly tolerate the lights. Um, the vocalization, though, her voice could not carry on a full sentence without having little breaks in it. And you could hear in her voice, you could hear the pain that this young lady was experiencing. And after 30, 40 minutes of using some of our tools and techniques, when we finally got that headache completely shut off to a zero, I asked her then to describe for us what things felt like, what she was experiencing when she had no pain. And her eyes were fully open. There was no more of the sensitivities to the lights and the sounds and things. But her vocalization was incredible because you could hear the richness of her voice, and it wasn't the staccato little short blips. It was communication like it should have been, but her vagus nerve was overwhelmed for years with this chronic pain pattern that she was going through. So waking up those systems to be able to function well, one of the things you'll first notice is the vocal cords. So we use
Very interesting.
vocalization in everything that we do. And with a child that doesn't vocalize, we encourage those nerves to start firing better. And we use that through vibration, through pressure on both sides of the brain, so that it helps be able to calibrate those vocal cords. And it's been so fun to see children start to talk within days of starting to use the device on some of these pressure areas.
Yeah, and I think talking about waking up the nervous system, I've had a really fascinating case where I think the child was only like 6 months old and was really having a hard time feeding, and the baby was actually in foster care. It was born with methamphetamine in the system, had some complications during birth, and it was interesting. There's a reflex that we often look for called the root reflex that I was thinking was not integrating. And when I tested for it, it wasn't there at all. And I was kind of surprised not to see it, because I knew that there was immaturity. There was low tone in that oral musculature. And it was, I knew there was a problem there. So we stimulated it anyway. What was fascinating, this is a reflex that should start like during pregnancy, right? During utero. And within about a week of stimulating that, all of a sudden it went from not there at all to fully activated. And vibration was the key. That's what we used with that stimulating vibration through that reflex, waking up that proprioception, that nervous system there, to let those neurons to fire for the first time. And it was just kind of like almost automatic doing that. So really, really cool way to do that. And it's not the same, I find, doing that without some sort of stimulation to that extent. If you just take like a paintbrush or something and do the same thing, it doesn't quite wake up those neurons quite like I know. And so I'm really curious into because one thing about vibration is there's all kinds of vibration, right? And I'm curious to learn and educate people more about the difference in frequencies of vibration, because that's really kind of a key thing, I think, in your world, right? That's probably, I'm probably putting you in a rough place trying to explain this, but I'm curious, kind of the science. What is the science behind altering those frequencies?
Some of what came about for us was studying the frequencies of vocalization. And then I started, I had a conversation one day with a good friend of mine who's a veterinarian, and I asked him about the purring of cats because I'd been thinking about it. And I said, tell me about the cat purr. And he said, oh, it helps the cat heal, and it helps their babies heal, and it'll help other animals. Oftentimes people will gravitate towards a cat when they are not feeling well, and it helps. And so I started studying that purring range of a cat, and I found some incredible things. Number one, it speeds up stem cell activity. It speeds up fracture healing. That particular range is so important that it helps all kinds of things. So I started focusing my study on the cat purring harmonic range. Essentially, I didn't want people to worry about kitty litter, but I wanted them to have the benefits of that cat purr. And so we created a tool. Essentially, we calibrated a tool. We take about 3,000 energy points from the low level of a cat purr up to the high level of a cat purr. Now, this is the calm cat purr. This is not a cat fight. The calm cat purr goes from about 20 to 120 cycles per second, or hertz. And a cat fight goes up into the thousands of hertz. So it's very different, depending on if we want to get into that perfect healing range. It's very low and very gentle. So we created a mechanism for calibrating that, and we use a spinning motor, and we calibrate it very calmly so that it speaks to the nervous system. And it took years to develop this, but essentially we use a device that puts that frequency back into the human nervous system through pressure points, and we teach people how to balance their vagus nerve through that process. Give it a calibration, if you will.
Right. And so I use it a lot in my practice. I mean, I use it for all kind of applications, and it's kind of funny because oftentimes, we treat adults and kids, but, my passion's definitely more with pediatrics. And, so I'm using a lot to integrate their primitive reflexes. So their primitive reflexes, these are like the foundation. The reflexes are there for the infant survival, but they help develop more complex networks in the brain that ends up, essentially developing their frontal lobes and cognitive function and all of those great things. But what I always tell the parents is like, you're going to end up using this too. I guarantee it. And so I know there's a wide range of uses with this. So what are some of the things that you find where people can utilize this tool?
Well, recently we've had several studies done on our device, and one in particular was done on headaches, and that is going to be up for publication in a worldwide journal pretty quick here. And it's a small trial, I think 60 clients, but they use our device, the RezziMax Tuner Pro, in a certain pattern that helps calm down headaches. We've seen it calm down headaches for years, but this was the first time to hand it to a set of researchers and say, you just do these techniques, and we'll create a set of these tools that sound like they're on, but they're not actually functioning, and you'll use that for the other group of people, and let's see which one has better effects. And the research showed that with a p-value of 0.001, which is incredible when you're doing research, but the RezziMax devices have a excellent ability to help with cluster headaches and chronic intractable headaches, and we'll see that published soon. Then we did another study on dysmenorrhea, which affects females to a large extent. Well, in fact, it doesn't affect males, but that has to do with the hardware there. Anyway, the cool thing about the research there was that it showed that just like it did for headaches, it calms down the pain of cramps and stomach issues and pain
During menstrual cycles, right?
from
That
menstrual
women, yeah,
cycles.
right.
And then we've got another study going on right now in TMJ, TMD, which is all about jaw pain. Well, the hardest thing that we face with our device is that if it affects things from the feet and peripheral neuropathy and plantar fasciitis and Achilles tendonitis and hammer toes and all of these things that affect the feet, and it affects the hand and trigger fingers and carpal tunnel and all kinds of things at the hand, wrist, and arm, and the stomach, and the head, and the jaw, the hardest condition we face is that people can't believe that it can be used for so many things and to treat children on the spectrum and to help children with ADD and ADHD. And, it just has so many uses. But if you go back to the science of it, Dr. Zederman, it's simply calming down the central nervous system so that things can function well. So when we can help people understand how it works, the RezziMax tuner has become one of the best tools that's non-medication to help calm down the nervous system, and then things start functioning how they're supposed to be.
Yeah, one of my favorite applications is, when we see a child for the first time, especially if they're, really impacted on the spectrum, one of the things that's most challenging is actually treating them, because they are oftentimes so, the eating kind of stimulation just throws them into some sort of meltdown. And so but the only way to kind of get past that is adding in that sensory stimulation. And so the RezziMax is such a cool tool that has such a variety of stimulation, where you can go into really intense stimulation down to a very, very light stimulation that pretty much anyone can handle. So one thing we'll do quite often when a child's really struggling to handle all the sensory lights and sound and different things we're bombarding their nervous system with, is even just turning this thing on and putting it at this. One of my favorite things to do is put on this K27 spot, because you can go right there. It's a big target, you can hit on kids, and it's amazing to see them. That's one thing, is someone, one thing I get from parents, and I'm sure you hear this all the time, is, what makes this difference from any other vibration tool I can get anywhere else? Okay. What makes this so special? But when you can put that on that spot and just see the child almost immediately within seconds you can just see it in their whole affect start to come down and their nervous system start balancing out. I mean, it's a thing to see. You can't really describe it, I don't think, without seeing it. But even my son now, I think I told you this when we visited before, when he's trouble sleeping, he'll come out and go, "Where's my RezziMax?" And he'll go and grab it and put himself to sleep with it. So it's such a fantastic tool. And I was really honored and glad you were able to come on and share this, because I think it's something that can benefit so many things. I mean, even when we talk about pain, my wife she had club foot as a child and had lots of surgery. So her joint down there is non-existent. It's very arthritic. And when she gets into pain, actually that helps more than loading up an ibuprofen, which is, I mean, what a great way to get pain relief without the damage that medication can do too. So I'm really thankful for you coming in and sharing this, because I think this can be revolutionary for not just kids, but all whole host of conditions. Because like you said, when we balance the vagus nerve, you are really influencing that parasympathetic nervous system, which helps us heal, helps us regenerate, and really has application to healing in any type of condition. So we will have a link in the show notes where you can look at all the different applications. There's also something you can utilize with your pets. Really cool things with that. I had a person who would use it on their dog and with severe arthritis, and got him up and walking, and that was a really cool story too. But we'll have some links in there where you can get that. We do have an affiliate code that you can use, DRZ, that will get you, I believe, is it $75 off? Is that correct? Okay. Didn't want to misspeak there. So we'll definitely have that up there. And Sharik, I really appreciate you sharing your time and expertise.
Oh, you bet. It's an honor to be able to share it with great doctors, because they can share it in such a good way and help people see it in their clinic and experience it. But there's a wealth of information on our website, www.RezziMax.com. And please, if you order one of these kits, make sure that you use the Dr. Z code. It's our way of sharing. It's our way of sharing and helping the world as best we can. These are great tools to help a lot of people. So thanks for sharing it, and thank you for helping your clients with it.
Absolutely. Hey, we couldn't help them without people like you making these great tools to help us get where we need to get to. So I appreciate it.